Washington, Capitol Hill. The murmur of voices fades in the Senate hearing room as the chairman announces. Next to speak is Senator Jim Banks. Light falls gently onto the table where a woman with composed posture and a calm gaze sits, hands neatly folded. Dr. Susan Monarez, nominee for the Director of the Centers for Disease Control and Prevention, prepares to respond. Senator Jim Banks speaks with urgency. Thank you, Mr. Chairman. Dr. Monarez, congratulations on your nomination. I believe the role you're stepping into is crucial for our country, and we want to support you in every way we can. But I need to ask you about a very serious issue. He flips through a file and continues. Every year, the CDC releases a report on abortions across the states. Indiana, my home state, submits thorough data, but many larger states don't. How do you plan to strengthen data collection on abortion and the related health risks, especially from those states refusing to report? Dr. Monarez nods respectfully, her voice even and thoughtful. Senator, data is essential to me. We cannot make evidence-based decisions without the right information. If confirmed, I'll prioritize strengthening our data collection and analysis, particularly in areas where the gaps are significant. Would you agree this database is critical? Banks presses. Yes, Senator. It's important. I'm not yet familiar with the exact systems in place, but I am committed to understanding them and working with you to improve participation. Banks doesn't look entirely satisfied but moves forward. Let's pivot. One of President Trump's initiatives was relocating parts of the federal bureaucracy outside of Washington, D.C., to serve Americans better. CDC is already in Atlanta. Why? What are the advantages or disadvantages of that? Monarez answers smoothly. Historically, CDC was placed in Atlanta during a time when malaria was a public health threat here in the U.S. Its southern location was strategic. Today, our distributed workforce across the country, and globally, allows us to stay connected to local and regional needs. That proximity matters. Banks leans back in his chair. So you're saying it works? Yes, Senator. It works. You don't need to run the whole operation from D.C.? Washington is vital for policymaking. But the health of Americans lives in their communities. We need to be present where the problems are. A quiet moment follows. Other senators listen, some taking notes. The exchange is civil, even productive, but there's tension underneath. Dr. Monarez, the career scientist, is navigating the world of political performance. And Senator Banks, the seasoned lawmaker, is trying to draw firm lines in soft terrain. The hearing moves on, but something subtle has shifted. Monarez hasn't just answered questions. She's presented a philosophy. Public health starts with presence, and presence requires trust. The hearing reconvenes after a short break. The room is quieter now, the media cameras are fewer, and only the most focused senators remain. Senator Jim Banks is still in his seat, flipping through notes. He speaks again. Dr. Monarez, the CDC has been criticized for being too academic, too slow to respond to emergencies. Do you agree with that assessment? Dr. Monarez maintains her calm expression, her voice unwavering. Senator, I've outlined 3 key priorities for the CDC if I am confirmed. First, modernizing our public health infrastructure. Second, improving our pandemic preparedness. Third, enhancing our data systems. These are not abstract goals, they're action items. We've heard the criticisms. Some are valid. It's time to act. Banks presses further. If another pandemic hits next year, will the CDC respond faster? That is my intent. And it will be my responsibility. We cannot let ourselves fall behind again. He narrows his eyes. What other weaknesses do you see inside the agency? Monarez nods slowly. Like any large organization, the CDC must always look for ways to improve. Operational efficiency, workforce development, better coordination with states, these are ongoing priorities. And we need to rebuild trust. That may be the hardest task of all. The senator pauses. The tension in the room thickens slightly. His voice softens. Trust. Yes. After COVID-19, that word means something new. My daughter nearly dropped out of college during the pandemic. She wanted to go into medicine. She almost gave up. Monarez looks directly at him. Her tone is measured but firm. She stayed. That means something. And if I have the chance to serve, I want to build a system she, and every American, can believe in. There's a long pause. The air feels heavier. Thank you, Banks says simply. Then adds, you've given us a lot to think about. Outside, the clouds roll over the Capitol dome. Inside, a fragile thread of mutual respect begins to form. The evening sky outside the Capitol turns a muted gray. The hearing room is empty now, save for cleaning staff quietly moving between rows of leather chairs. Inside a modest office 2 floors up, Dr. Susan Monarez sits alone. Her blazer is draped over the chair. The room is dim, lit by a single desk lamp. In her hands is an old photograph, she and 2 other women in lab coats, smiling awkwardly in front of a Massachusetts clinic. Her phone buzzes. Unknown number. She hesitates, then answers. Dr. Monarez speaking. A familiar voice. It's Jim Banks. I hope I'm not calling too late. She straightens up slightly. No, Senator. Not at all. I just wanted to say, you handled yourself well today. Those weren't easy questions. She exhales slowly. No, they weren't. But they were fair. There's a pause on the line. My daughter called me tonight. Told me she watched the hearing. She said, Dad, that woman actually sounds like she gives a damn. Susan smiles quietly to herself. That means more than you know. I believe you, Banks replies. Look, we're probably going to disagree on policy. But you answered with honesty. That's rare here. I've worked in public health long enough to know it doesn't matter who gets the credit, as long as the right thing gets done. Another pause. This time, longer. We'll see what the committee decides, Banks says. But I think you've made an impression. They exchange polite goodbyes. The line disconnects. Susan places the photo back into a drawer and leans back in her chair. Outside the window, the Capitol lights gleam faintly in the mist. Something is shifting, not just in politics, but in the tone of what's possible. Tomorrow will come quickly. 1 week later, the committee gathers for a final vote. The hearing room is fuller than usual. Reporters, aides, and silent observers line the walls. The tension is not spoken, it's carried in posture, in the rustle of papers and the measured glances between colleagues. Dr. Susan Monarez sits quietly near the front, hands folded again, this time with a small scratch pad of notes she hasn't looked at once. This moment is not about performance. It is about readiness. Senator Banks is handed a ballot. He stares at it. The checkboxes are simple, yes or no. But the choice carries weight. He remembers the hearings. Her answers? The phone call. And most of all, his daughter's voice. She sounds like she gives a damn. He marks yes. Minutes later, the chairman announces. By vote of the committee, Dr. Susan Monarez is confirmed as director of the Centers for Disease Control and Prevention. No applause. Just a wave of exhalation across the room. Monarez nods quietly. Then she stands. That night in Atlanta, she walks the corridors of CDC headquarters. The building is quiet, almost reverent. She pauses by a wall of portraits, past directors in black and white, caught in still moments of urgency. She whispers, My turn now. Far away, in Indiana, Jim Banks is driving home from a town hall. The sky is golden with the last light. A radio host mentions the CDC confirmation. He turns the volume down and just says to himself, Let's see what she does. Her first day as CDC director began without ceremony, no grand welcome, no speeches. Just the hum of fluorescent lights and the distant echo of shoes in the hallway. Susan Monarez stood alone in her new office, a quiet space lined with reports, manuals, and empty whiteboards. It smelled faintly of dry ink and carpet cleaner. She touched the polished edge of the desk. Beneath it sat her old bag from Boston, still zipped, containing nothing but her stethoscope, a legal pad, and the same photograph she had looked at a week earlier. She placed the photo near the monitor. A small reminder of the beginning. The knock on her door was soft but deliberate. "Director Monarez?" A junior aide peeked in, holding a tablet. "Morning. We've got a 9:15 with the Pandemic Response Task Force, a 10:30 Data Systems Audit meeting, and a noon update from regional field teams." Then Senator Banks asked for a brief check-in call, if you have 10 minutes. Susan smiled slightly. "I'll make 10 minutes. The morning passed in dense conversations, reviews of emergency preparedness protocols, discussions on rebuilding public trust, projections of resource gaps in underserved regions. Some faces were skeptical. Some were curious. Most were tired. But they listened. At 12:05, she dialed the number. "Banks. Senator, it's Susan Monarez. I said I'd check in." "Appreciate that. So how does it feel? Director of the CDC. Less like a title, more like a responsibility." "Fair enough." A pause. "Look, I won't keep you long. I just wanted to say, don't forget why you got the job. It wasn't politics. You talked straight. You didn't dodge. That's the only way I know how to talk, Senator." "Good. Because if you ever stop, you'll hear about it from me. And from my daughter." Susan laughed lightly. "Understood. One more thing," Banks added. "There's a lot of noise in this town. Keep your compass. Doesn't matter which side you're on, if you lose that, you lose everything." She nodded silently, even though he couldn't see. "Thank you, Senator. Truly." After the call, she walked the halls again, meeting new staff, checking in with lab teams, reading names off door plates that bore the quiet weight of decades. She paused once, watching a pair of interns talk over coffee, notebooks full of hopeful questions. She remembered that age. The idealism. The awe of impact. At the end of the day, she returned to her office. The sun had dropped low behind the CDC's wide plaza. Her phone buzzed. A message from Banks' office. "Let us know when you're ready to talk long-term regional coordination. Indiana's ready to listen." She smiled. Not at the political opportunity, but at the word. Ready. That night she stood by the same wall of portraits, now dim in evening light. She looked at each face. Past crises. Past answers. Past mistakes. Now it was her turn. And she was ready.